Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, October 13th, 2022. And our top story today, Medicare Telehealth. Actions are needed to strengthen oversight and education of patients about privacy and security risks. Joining me now to discuss this and a lot more, Leslie Gordon is with the Government Accountability Office. Well, Leslie, thanks so much for joining us. Really appreciate you having you and the Government Accountability Office on the program this morning.
It's a pleasure to be here, Jeff. Thanks.
It's great. And you know, we last spoke with your colleague Chris about some retirement work that the GAO does, but the GAO is really involved in so many different aspects and overseeing and taking accountability of what the government's doing. You did a report, you and your team, I should say, because it's never just one person, did a report on telehealth in the pandemic and how it relates to Medicare. First, telehealth broadly. How was telehealth used during the pandemic?
So when the pandemic occurred, the Centers for Medicare and Medicaid Services were allowed to use a regulatory authority to expand access to telehealth services. Previously, Jeff, it was only for delivering services in rural areas, specific geographic areas, and the waiver that occurred to allow it to be used in the pandemic opened it up to anyone regardless of geographic area. It also expanded the types of providers that could deliver services using telehealth. So this is where a patient would connect to their doctor either over a video connection like Zoom or the internet, or connect via telephone.
Yeah, it's I have to say, I like going face-to-face to the doctor. I think that's important, but certain ailments, you know, if I have a bite or something, might be able to be treated, or a sniffle, might be able to be treated and better treated through telehealth. So let's fast forward through the pandemic, or quasi at the endemic stage. I'm not sure we're there yet officially, but I'm just going to throw it out there. What are some lessons that we learned? Is this a better tool for individuals of all ages, but particularly people who are at Medicare age and deriving benefit from the Medicare program?
Well, our study didn't really come to a conclusion about whether it's a better tool or not, Jeff. We identified there was definitely an increase in use, right? We saw a tenfold increase in use of telehealth services. So we went from 5 million services to 53 million services, looking in, sort of a half-year period comparing 2019 to 2020. It did allow a number of people to see their doctor and not have the concerns about infection with COVID. It allowed folks, who are immunocompromised to access services for their doctor. I used telehealth in the pandemic. I think we all sort of stepped up and had the opportunity to access services that way. So it certainly made getting an opinion, getting contact with your doctor a lot easier.
Absolutely. Let me ask you something that often comes up, because not everyone has access to internet, and that is a challenge. I want to ask you about equitability, and were people who maybe didn't have access, typically have access, maybe they have phones, maybe they have devices, maybe they have some level of internet. Are there groups of people that did not have access to telehealth?
What we heard from the stakeholders we talked to, particularly the provider groups, was often with the Medicare population, the service would start off with an attempt at a video conference, sort of face-to-face over the internet. And then when the technology failed due to broadband issues, due to, just unfamiliarity or connectivity, then it would devolve to an audio-only call. So we heard from stakeholders that about half of their visits, the providers were saying about half of their visits ended up in being just telephone only. We heard the same thing from beneficiary groups. Beneficiary groups acknowledge that some folks don't have broadband access, and some folks just don't have a comfort level connecting to their doctor over video technology. So many times, although CMS wasn't able to track when those visits were delivered via telephone only.
Yeah, but look, I think during this circumstance, it's almost like you're triaging, right? You're trying to just figure out during the pandemic how best to implement your services, and there's some lessons learned through that. And by the way, we see that in other with way business is conducted. People went from Zoom meeting, going into the office and having meetings to working in their shorts and I would say a t-shirt, but maybe a button-down shirt so you couldn't see below the sternum, and they would use Zoom. Leslie, I need to take a very quick break. When we come back, we'll talk more about the impact to the quality of healthcare using telehealth. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
I was out of work for about a month. I wasn't there to help my husband. He had to take time off work. I have health insurance, but it doesn't cover everything. The AFLAC policy helped me while I was out of work simply because it took the stress and the worry off. AFLAC helped with copays, deductibles, and a lot of the upfront expenses. The AFLAC insurance helped relieve my family's financial stress.
Welcome back. We're joined this morning by Leslie Gordon of the Government Accountability Office. We're talking about Medicare Telehealth. Leslie, thanks so much for staying with us. Really appreciate you sticking around for segment 2 this morning.
My pleasure, Jeff.
Really interesting and really topical. I mean, there are so many people retiring today, so many people using Medicare and maybe Medicaid services, and telehealth doesn't seem like a topic that's going away or a subject or a medium that's going away. Let's talk about quality, and I think you and the team at the Government Accountability Office looked at how this could impact the quality of telehealth and medical care.
Sure, Jeff. When we did our study, we identified, sort of the increased use means this is something that both providers and beneficiaries found, to be of benefit and convenient, definitely during the pandemic. However, the Centers for Medicare and Medicaid Services, CMS, lacks data to really understand whether services are being delivered via telephone only, via the telephone only, and also where the beneficiary is. They're not tracking if the beneficiary is receiving services in the home, which is what we assume is happening, but still that kind of information is needed. And then we found that the Centers for Medicare and Medicaid Services had done some work to develop metrics and ways to measure quality, but they hadn't developed a plan. And as of the time we spoke with them earlier this year, they had not decided to implement a quality assessment. That's one of our recommendations. It's really critical to understand what happens when these services are delivered. Are they medically necessary? Are they delivered equitably to all beneficiaries? And do they result in improved health?
Yeah, and certainly you got to take these recommendations because we can always do better. There's no perfect system. Let me ask you a question. Maybe this wasn't directly covered in the report. I don't think it was, but it may be something that of interest to the Government Accountability Office. That's privacy. And I wonder, privacy and data, because you mentioned, look, the CMS didn't have certain data points and maybe it wasn't available. Like you don't know someone's location. You would have to track the location maybe through the phone. They would have to put that in. But how do you balance some of those needs with privacy? And this is a topic that probably is above both of our pay grades now. I think the Congress is wrestling with this. The administration's wrestling with this. But privacy, I would think, would be really important when it comes to telehealth.
Yes, it is. In fact, there is an agency within the Department of Health and Human Services, the Office of Civil Rights, that's responsible for ensuring privacy, security of the data that you have in your health record. So when you go to the doctor, you will file a release about who can have access to your personal health information. In the pandemic and with telehealth services, the Office of Civil Rights in the Department of Health and Human Services waived their enforcement of privacy and security rules related to telehealth. What this means, Jeff, is that they wanted providers and patients to be able to access services via telehealth, and they knew that not all beneficiaries, not all patients, not all providers would have secure video channels to do that. So, understandably, they said, we're going to hold you harmless as long as you try to do the right thing. And that's fine. However, they just told providers, we encourage you to explain this to your patients. At JO, here we are 2 years later into the pandemic. We think that the Office of Civil Rights should be doing more than just encouraging providers to explain that some of the telehealth platforms that they've been that providers may have used were not compliant with privacy and security regulations. So we have a recommendation that they do more outreach, provide guidance, or even language to explain in plain language so that when you're connecting to your doctor over a video technology platform, you have at least some awareness that there might be more risks about privacy and security.
Yeah, really important. And again, probably above our pay grade. I know this is something that's being discussed in the Congress, the Senate, the White House, et cetera. Last question, Leslie, what can we expect from the Government Accountability Office in terms of more research around telehealth, the delivery of services? Is this an area that you plan to follow up on in the next several months, the next 12 months, et cetera?
So, Jeff, we always follow up on our recommendations to the agency, and we stay in close communication with Congress. Our job is to support Congress in its oversight responsibilities. So our work is generally requested by them either through a letter to the Comptroller General or via actual law. It directs us to do work. So I do expect that we will be doing additional work in the telehealth area. As you said, telehealth is not going away.
No, it is not. I think we're going to be using it more and more, but also for more important maladies. I think we're probably going to be going, just my personal opinion, we're going to be going to see the doctor. Leslie, it was so great to have you. Thanks so much for stopping by, and we look forward to having you in the Government Accountability Office back on the program again very soon.
My pleasure, Jeff.
That wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? We'll visit our website and, of course, our streaming partners. Guess what? We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.